Good morning, everyone. Welcome. How are you doing this morning? Everybody made it through traffic except for Dr. Kelder, but he's going to slip right in after we start our panel, and he knows his stuff, so we know he'll be here soon. So we are really hoping with this training today to help everyone understand and to pre-educate before we get to our November meeting, where we're going to look at a menu of possible policies for us to pursue as a council, and we'll be making that decision on what policy we want to pursue in December. So this is kind of building up kind of a body of knowledge for everyone and kind of the guardrails that we're trying to stay between as we look at how the Health Equity Policy Council will operate. So we're going to be exploring how policy and programmatic efforts differ, because there's a lot of mushiness between those kinds of things, and we want to explore that line and the gray areas. We really want to help everybody understand that as a standard, the Health Equity Policy Council is really going to be promoting evidence-based or best practice policies when we first roll out. And what is that? How do we define that? We really want to talk too about what type of policies can be adopted at this local level within the boundaries of Travis County, because that is our focus, just to remind everyone. We're not looking at influencing state policy or federal policy. What we're trying to do is have the most progressive and forward-thinking health policies to help stem the tide of health disparities and reverse that direction here locally. What can we control? What can we influence? And then also, we want to understand which policies we can choose that will help move the needle on our 4 priority areas of HIV, tobacco, obesity, and diabetes prevention. So with that, we decided, as we were designing today, that we would have a variety of learning activities. And instead of just having kind of the speaker presenter and continuing on with that, we've tried to mix the day up a little bit to make it interactive. And we were really struggling with this first session, and then we decided we have a panel of experts here that we can really pick their brain, and you can hear a little bit about what went on behind the scenes of local policy initiatives that have occurred in our community, and we thought it'd be really interesting for you. So we're going to start off with this panel that I'm going to moderate today, and I'm going to introduce our panelists. So in absentia, I'm going to introduce Dr. Kelder. He's the Associate Regional Dean with the University of Texas School of Public Health. He is on his way. He's also the Beth Toby Grossman Distinguished Professor of Spirituality and Healing, which I did not know, and co-director of the Michael and Susan Dell Center for Healthy Living. He has an extensive biography with 25 years of experience in design and evaluation of child and adolescent health research. And you have his bio, so I'm not going to go into any more details, but it's really impressive, so I encourage you to read it. Next to Dr. Kelder, we have former Austin City Council member Laura Morrison. Thank you for being here with us today. She served 2 terms as an at-large city council member from 2008 to 2015 and was a champion for quality of life issues with a vision for a city that embodies neighborhood sustainability, a healthy environment, affordable housing in all parts of town, thriving local businesses, a creative community, and social equity. And she also had public health as a focus of her tenure. For example, she helped to initiate a smoking ban in public parks and organizing a childhood obesity forum for citizens commissioners. So we welcome you and thank you for being here today. And then Rodney Ahart, who is now the executive director of Keep Austin Beautiful. You are a 3rd generation Austinite.
Yes.
Wow. Deep ties with the city. He comes to Keep Austin Beautiful with 12 years of experience. He served as the chief of staff in the Texas House of Representatives for over 6 years. While working at the Capitol, you gained valuable experience on diverse issues such as education, health, business and industry, appropriations, and the environment. And he served as the Government Relations Director for the American Cancer Society, and spearheaded the volunteer-driven ballot initiative, making all public places in Austin smoke-free. I also just want to add that with Rodney, when I was working with the Business Journal, I helped to create a public health award that they had not had before, and luckily Rodney was the recipient of that for that work. So thank you for being here. So first, the question is for all three of you. I'm just going to pretend that's here. We'll catch him up when he gets there. So we talked about ways about how to promote healthier lifestyles, and you can promote healthier lifestyles through policy, through programs, and campaigns. But let's hear from each of you, out of your thinking and the experience that you have. What is policy? How do you describe policy? And I don't know who wants to start first.
I'll start.
Okay.
I guess I want to just start by saying what a great idea this is, I think, to have this citizen council on public health policy, because I think some great things can come out of this. I'm really excited that Central Health has moved. I feel like Central Health has really moved into a strong advocacy role, and you all are part of that. And I think this community needs that. We don't have really, in my experience from City Hall, a cohesive public health advocacy group. So I'm really glad to see this.
Well, I think you were one of the reasons that kind of spawned part of this effort, to kind of energize us and when you challenged us, which we'll talk about later.
Yeah, right. So as Christy said, it's a little bit of a squishy area. What is policy? I feel like I know policy when I see it. It's guidelines, it's approaches to things, it's strategies for dealing with an issue, a problem, something that the community needs to take on, as opposed to implementing a plan and actually taking action on certain things. So that's how I would describe it. And I can tell you, it's fun to see some familiar faces here. I can tell you that at City Hall, we have a council manager form of government. Well, the city has a council manager form of government. The council's supposed to set policy, and the manager's supposed to implement and do programs. And let me just say, we had plenty of arguments. Cheryl can tell you in the back. We had plenty of arguments about where was that line? What is policy? What is programs? Is council stepping too far into the administration and implementation of something? And vice versa, is the city manager and staff moving too far in to setting policy? So there can always be, I think, sometimes vigorous debate about what policy is. And in preparation for this, I thought, policy, I don't know, is there some right answer? So I looked it up. And in the dictionary, and
did you Google it?
I did. It was like, what is policy? And I figure maybe Steve can give us an academic answer to that when he comes. But it was clear from the definitions that it is sort of a squishy thing, but I think that we know some of it when we see it.
Right. Okay, Rodney, you're up at bat.
Okay, well, I too want to thank Christy and Megan for the opportunity to be here today. I think that in so many things, I can look back in my life and the things that I've been involved with, and I feel like everything always comes back to health. And I think it's such an integral part of our community and such an important part of our lives. And, I look at policy as very simple. I look at it as laws. I think that, and the great unique thing about policy is that it is legacy. It outlives us. And so I think that's one of the key components of policy that is so outstanding, is that it can outlive us, and it has such a long-standing impact on the community. And, you look at programs, I currently serve as an executive director for a nonprofit, and there's probably some nonprofit people in here too, that we are constantly raising funds for programs, and you wonder at times, are we going to have the funds to continue these programs? So I think that like I stated, one of the beauties with policy is just that it can outlive all of us and have such a substantial impact.
Yes.
And I think, I can just talk a little about the smoke-free policy in Austin. You know, you talk about the policy. I look at it as almost like a soap opera. It was 2 mayors, 2 councils, 4 lawsuits, one ballot initiative in order to make that smoke-free policy happen. I mean, started in 2003, went into effect in 2005. We had, legal challenges all the way until 2008. So, just to talk about like kind of that soap opera drama of the policy ride. But I do think that, it's one of the best things you can be involved and engaged in, because like I said, it truly can outlive us and have a big impact on generations to come.
That's a really good description, and you can see as both of you are building this description that it takes a shape. That not just everyone brings their perspective to it, and I actually have a perspective from an academic journal, which I thought I'd read, and especially now since Dr. Kelder isn't yet here. But it says here, policies are generally more influential than programs. They have broad applicability and are implemented upstream. That's why in our orientation to the Health Equity Policy Council, we call it upstream healthcare. Setting the course within which people and programs must navigate. To Rodney's point, in addition, policies tend to last longer than programs because they codify change and they survive individual leadership transitions. So regardless of who, we have a brand new city council, but that did not affect SIPO, right? It's still there. The leadership is not, unless they choose to change it,
right.
And go through it, which we hope they don't, unless it's in a positive direction, which Dr. Wong will talk about. But and the government can also mandate compliance with a policy if need be, and take appropriate enforcement measures, which allows a social norm to be created and a direction to be created that a program which is servicing just a small cadre of individuals doesn't have the ability to do. When we pass a policy, then all of a sudden everyone who, if it's the city, it's everyone in the city is affected, regardless of, your socioeconomic status or where you live, or it's broad and far-reaching. So let's go on to what types of entities can adopt policies and brainstorm around that a little bit. And there's some very obvious ones, but there's also some not so obvious ones.
Well, the obvious ones to me are the city council.
Right.
And I guess I want to, for me, I like your definition, Christy. I think that really nails it. And I think that it's important to realize that in putting it into law or an ordinance certainly solidifies something in one way. But we did a lot of resolutions that weren't actually ordinances, but they were just sort of general guidelines about how the city was going to proceed. And I think of some examples. I think one of the clearest ones that I think is a policy is that we adopted that said within the urban core, everyone will live within 1/4 mile of a park, which is really a terrific, it's a goal, but it was a policy which helped to define how we were going to help staff develop their land acquisition program, for instance. So it sort of goes beyond, but let me just say it's a lot easier for policies adopted by resolution to sort of filter off the landscape and off the radar, but sometimes it's just not appropriate to put something in an ordinance.
Okay, so a resolution in your mind can define policy.
Absolutely.
It doesn't have the same, let's say, weight. Okay.
Yes.
Okay.
Right. Because if in fact it gets violated,
right.
It's like, people can be down there screaming, or council members can be screaming, but it's like, okay, so what? So
there's not an enforcement mechanism or some kind of teeth.
There's no teeth to it. But it can be very forceful in terms of helping to move the city in a particular direction. Mm-hmm. So the city has the authority, obviously, to do policy. The county does also, although in terms of real authority, the city is a home rule city. So the city can, and that means with the state, that the city can do everything the state tells us we can't do. And the county is the opposite. The county can only do what they're explicitly allowed to do. But don't fool yourself, because sometimes the city does things that we're allowed to do, and next thing you know, up at the ledge, they're like, no, we're changing that. So in the school district and the state and the feds, and I think it's important to understand who can do what, where the appropriate political level is to go after something, and also the interaction between those.
Yeah, on the call that we had in preparation, we were talking a little bit about sometimes we run into issues where we think we have local control, but then there's actually triggers something with the state or the feds that we weren't aware of.
Right.
And so that's happened in your experience?
One of the examples that I ran into was one of the things I was interested in working on, and including with some of the staff that were here, was the whole drug take-back issue, because it's a public health issue. Having unnecessary drugs in the house. It's an environmental issue, because when people dump their old drugs down the drain, and it impacts water and fish and all of that. It's a public safety issue, because there are certainly times when those drugs get onto the street, and crime and all of that. So we thought, great, we want to do something that put together a policy and help programs develop that would allow our pharmacies to take back drugs, to be able to get them out of people's houses. Turns out the DEA, the Drug Enforcement Agency, those guys that go out. Me and the DEA are like this, because they also, they were very interested in that. They have a twice a year drug take-back program that you might have heard about. The problem that we ran into was that there were limitations on pharmacies. We wanted pharmacies to be able to just take them back year round. There were limitations on pharmacies being able to handle controlled substances. John Cornyn, who's our senator, who frankly, I don't really agree with him on many things, but this is, it's an interesting lesson to look for crossover political allies. He was very involved in this, and it turned out he helped to get something passed at the federal level to be able to make pharmaceutical take back a reality. Turned out that the rulemaking for that got stuck. And apparently there were some hesitant agencies that got it stuck. But I read, and so I talked with him. He said, yeah, whatever you can do to help, to advocate for us at the federal level to unstick it. And we did. I think we had a letter written and all of that. And I just read that, in fact, it's been passed. It's all going to be implemented now. And it was part of Obama's big new release on drugs in general. So that was a really good lesson for me about, I wouldn't naturally think that me and the DEA are going to be working together.
Right.
And you can work together.
When we have designed the tool that some of you saw at the first Health Equity Policy Council training, one of the questions is this something that we can do locally? Mm-hmm. And we're really going to have to, it's not something you can just say, yes, we're going to have to do some research to figure that out, to make sure that it is something that we can do. So Rodney, what have you got to add to this whole types of entities?
Well, I think the one that Laura has already stated is definitely through the ordinance process, mm-hmm. through the city council. I look at change two ways. It can happen from the inside out or the outside in. And for most policy like initiatives, you have to have a combination of both. Mm-hmm. And so I think when we worked on the smoke-free campaign, it was so important to get champions on the inside that could actually, work those policies, like a Laura who can work those policies through, the council process. But then, as we all know, elected officials must have cover. They have to know that their citizens support this, because what happens? Everyone's up for re-election, and so you have to make sure that we provide that cover to them, that your citizens want this. You can vote for this, and stay in office. And so, so I think that's an important part as well.
Absolutely, yes. Elder, Elder, welcome.
Hi there.
Hi. So, we have been discussing the difference between policy and programs, and we've been talking about what kinds of entities can adopt policies. So we're going to let you just get rested up here a minute, but I'm going to come back to you because we want to hear one more definition about policy from the academic perspective, unless you're ready to go now.
Well, I think I'd rather talk about mass transit. In Austin, that could be the healthiest thing we've ever talked about.
Blood pressure gets lowered, community wide.
Indeed. So, I think I could just jump in, I guess. I don't know if an academic perspective is that much different than other perspectives, but, to me at least, when I think about policy, from my perspective, I want to determine its effectiveness. So it's that you can suggest policies which are based on best practices or based on theoretical orientations or based on very good ideas that make a lot of common sense. But, if you can take those policies and create an environment or create an evaluation plan within an environment to determine whether it's doing what it's supposed to do, that's where my interest comes from. Because, sometimes these policies take a great deal of effort, a whole room full of people to agree, and there'll be competing interests when you implement any or most policies. So understanding the true effectiveness of it, as well as the unintended negative consequences, I think are important to consider. And if you haven't done too much upfront evaluation, then there's a greater chance of likelihood that you might get it wrong. So that's where I come from, and then so there's experimental approaches to do that. Mm-hmm. So a policy, in a smaller sense, a policy is a rule or a decision of something which gets applied to a whole population. A policy for a school district might be that they're going to adopt a daily physical activity. So a minimum of 30 minutes per day. That would be a policy. You don't need any program. You don't need anything else. You need a lot, actually. That particular one would probably cause a great deal of disruption in the school day because schools have a fixed schedule, and then adding more time to it would mean hiring people, changing things around, doing things different. So that's just one example from my experience.
Yeah, we talked a little bit about how policy can apply to entire population. I like the way that you frame that. And also, you just brought another policy-making body forward, which is the school district, which we think is another really important, or school district, since we're in Travis County. We're looking at all of the school districts in Travis County and the policies that they can implement that affect our children. And so that's another body that, and I know you've worked in the schools quite a bit, or in the school arena.
Yeah.
So, yeah.
I have. Texas Education Agency will set the education code. I take that back. It comes from a legislative perspective. What gets written into the education code, and then the education code often gets translated through Texas Education Agency, which will send out information to superintendents. The superintendents will consider what is in the new education code, and then they'll take action. So I think it was 10 or 12 years ago when elementary schools were required to have 30 minutes per day of physical activity in PE, which was the example that I gave. Actually, it's not in PE. It's 30 minutes of physical activity, which can be done in any way that the school sees fit. So that could include activity breaks in the classroom. It doesn't have to be physical education, so you have to pay careful attention to the law. But so when I think about influencing policy, one could take a state legislative approach if you're talking about school systems, and then you could try and influence all the school systems. Or you could go to a school district like AISD or Pflugerville or any of the other ones around here and talk to their school health coordinator. Their SHAC, their school health committee, which was a policy which came from the USDA.
Right.
So schools that receive federal funding for free and reduced lunch and breakfast programs are required to have a district-level school health advisory council. So, which is another example of a policy. They're not. There's minimal direction on what they have to do within the confines of that council, but it's a place for schools to pay attention to health issues of which we're talking about.
Yeah.
Christy, can I just add, I think in terms of getting a grip on what policy is, one thing I think that might be interesting for all of you is to go look at the community health improvement plan that the community adopted, the council endorsed. Central Health was obviously part of it. Our great folks in the city department led the effort. But it basically came up in lots of community involvement. What are the priorities? What are our goals? What are our objectives? And for each of the adopted objectives, it's really interesting because it talks about what is the objective? Is it going to require a change in policy? And what is the evidence that this policy is going to be effective? So another way to what Steve was saying. And so it's really nice the way it breaks it down. It gives you some background and helps you really distinguish, where policies come into play and where they're talking about programs.
That's great. I want to start talking a little bit more in the weeds about examples of specific policies or policy initiatives that have either been very successful. And we're going to start with the successful one. We're going to start with SIPO. And then where some things have gone awry, or where maybe, Dr. Kelder, of a policy that was implemented that wasn't evidence-based best practices, and then if there were any negative outcomes or unexpected or nothing really happened or to move the needle in the direction we want to go. So you started us down that path around what this took to put
make
this
the smoke-free policy happen. I mean, first I have to recognize Dr. Wong because he played such a significant role in us getting this policy passed in the city. I mentioned earlier that it took 2 mayors, 2 councils, 4 lawsuits, a ballot initiative in order to make the smoke-free policy happen. And, like I said, I just felt like it was this smoke-free soap opera. Of course, our first stance was to try to pass this policy through council, which, get your 4 votes on council, pass a policy. At the time, Mayor Garcia was the mayor. He was in his last term. He had made the decision this was a policy that I wanted to definitely pass before I leave office, and went through that whole process, had the ordinance passed, but, and you were just talking about the timing. Before that ordinance went into effect, a new council was elected. And we had a mayor at the time who wasn't in support of all the initiatives in the ordinance, and so kicked it to a subcommittee. The subcommittee was myself, a couple health advocates, and then we had a large amount of bar owners who served in this committee. And it was also led up by a council member who had clearly voted against it both times. So
the subcommittee that you were
the subcommittee that we were in. You remember this, Dr. So ultimately, the ordinance was stripped of. It became a voluntary ordinance. You can put up a sign, all of those type things. And so we all kind of went back, looking at our wounds. What can we do? What can we do? We can wait.
No teeth.
No teeth whatsoever.
Okay.
So we had the option to look at. Okay, we can wait for the council makeup to change, or we could actually do a petition and place it on the ballot. And so that was the route we went. We had to get over 36,000 signatures of registered voters. Got that placed on the ballot. It passed by 4 percentage points. It was 52 to 48. During that whole process, I think, one thing I think that the advocates and everyone in support had to just keep driving home is that it's a public health issue. Everyone has a right to smoke-free air. Because I think as you kind of go through those processes, you hear so many different reasons as to why it's not going to work. I think that this is going to be the end of live music. You're going to end hospitality industry. And I think we all have seen the exact opposite has happened. So
people are still coming to Austin.
Yeah, I know.
In fact, we're all on the road right now.
Exactly.
It will go away.
Yeah, exactly. Everybody.
And they're still eating, and they're still drinking.
They're still drinking, they're still going to hear live music.
Yeah.
So such a case in point of how you can pass a health policy and still, and bring a huge value to the city, which I think it has been a huge value to the city in so many ways.
It has, and Dr. Wong's got some we're going to get a peek at some data that shows the impact of this, just to, again, explore and explain with you how important, the policies that we can produce and pass can actually move the needle on certain indicators that we're trying to move the needle on. I think that's so interesting because, you were working with policymakers, those in leadership, and then the leadership shifted, pulled the rug out from underneath you, and you had to go down a different pathway. And I think that we know as we look through and analyze what we're going to do, we're going to get into those kinds of situations. And ultimately, in this situation, your tool was to go to the voters and just ask them. And that kind of bypasses the policy, the leadership, elected official leadership, and lets the people decide, which is the most democratic process, right?
Yeah.
So that's interesting.
I just want to add one of the consequences, besides all the great consequences, that Cheryl and I worked on together was that we all of a sudden had all sorts of rooftop music venues, which means we had music, wafting through the neighborhoods, which means we now have a music division, we now have a venue fund, we have all sorts of stuff that supports minimizing the impact of music that we probably wouldn't have had otherwise, or at least to the degree, and it's good. It's really good, but again, people were like, if you do anything to music, it's going to kill the music industry, and it doesn't. But it was some follow-on work from that.
Interesting. Yeah. Another kind of probably unforeseen.
I think it was unforeseen.
Yeah. I agree.
Yeah.
Unforeseen consequence. Yeah. Well, have you got a thought about any policies that you've seen that's put in place that hasn't really had the effect you'd hoped or thought through, or an example for us?
First of all, I think about categories of things that can go wrong. So you might imagine a policy, you might actually go through the hard work that you're just talking about to get it enacted. It might, it might require some cash. Oftentimes it does to educate people, or to actually implement the policy. Might mean a construction change or some other type of change. So when I think about the categories of what could go wrong, it could actually do the opposite. That would be bad. So that means you need to measure it in some way, shape, or form. Or it could lead to a great deal of controversy and make a lot of people uncomfortable, like elected officials who get lots of phone calls, or the rally charge against people who hate this or that, and and it might tip the scales one way between political dimensions, which are very different. It captures the moment of the media's attention and such. Or it could create, a lot of work by people who really hadn't anticipated having that work. So when I think about, some policies that may have gone awry, for example, there's a UT person in the LBJ school, Susan Combs. This isn't necessarily a policy, but when she was comptroller, she initiated the Texas Fitness Now program, which allowed schools to have a great deal of new money. And it was backed with Senate Bill 42 that required middle schools to offer more physical education in middle schools. So it went from 1 semester per year to 2 semesters per year. So it actually did that disruptive example I told you about. So in order to make it a little easier, the legislature didn't accompany any money to help retrofit the schools, which needed new equipment, supplies, and training and staff. So Comptroller Combs then somehow, I don't know exactly how, but that's what those people do, found some money for lower income schools to apply to the state to get funds to retrain and build their program. So that money was let out. The goal of the funds was to reduce obesity, as was written in the whatever waiver that generated the money in the first place, to lower obesity, and that therefore would increase test scores. So an examination of the effects of that policy took place, and just this summer a paper came out and it found out that, lo and behold, it did not lower obesity. So it was deemed a failure. On the other hand, it showed that there were increases in physical activity and fitness. but that wasn't the stated objective. So you've got a conflicting set of results coming out at you. And this is, the evaluation was done by a professor who just happened to have the data sets available and thought it'd be cool to write a paper.
Yeah.
So there wasn't any mandatory evaluation of it. So sometimes even the evaluation results can cause discomfort. And that led to sort of a lot of controversy within the PE community. And then is also something that gets pointed as to, well, we can spend money on education, we don't get anything. So therefore, it's just more government throwing money at education and not getting what you want, when in reality that wasn't exactly true.
Right.
Although because I'm in this field of school health, I can tell you there was some wasted money along the way. So if one looked at where the dollars went, and there is a report about where the dollars went, training the PE teachers to go to a conference on how to be a better football coach doesn't necessarily help the whole population of kids. So I mean that's just it's too easy to say it's the vagaries of implementation.
Right.
But the whole policy came about at a very quick ending of the legislative session. All of a sudden a bunch of money was allocated, and the hardest part was to get the schools to apply to get the money out. So it turns into a big government thing where you shovel cash at people and hope that they do the best. So I don't know if that's a negative thing per se, but it is one example.
Yeah, I think we need to explore all of these so we can have this perspective of what can go wrong. And again, I keep going back to our tool, our pre-evaluation tool. Like when we're going to look at these policies, we're going to need to kind of think through that in advance so we have some ideas. We'll be guessing, of course.
Yeah.
We'll be predicting. We won't know for sure, but at least we'll have thought through some of that. And we also have plans to make sure that we have an evaluation component. We don't know what that looks like yet, but we want to. And again, even if you do have an evaluation component, you're guessing on the front end as to what you think you're going to move, and you might move, factor A instead of factor B, which so. It's science, but there is some variability there. Yeah.
Right. I could think of another one.
Yeah, sure.
This time, the USDA put out changes to foods which are served to kids in competitive food lines. So this is now a federal policy, which comes down to the state, which comes down to the school district, which comes down to the school. So you can influence all, which is one of the points of the higher order policies, is to make a broad, influential change. So the competitive foods, if you don't know, in middle school and high school, are the foods which are what's called the a la carte line. They're not governed by USDA, especially if you get the free and reduced lunch. The foods which are served in that category of the food line meets USDA guidelines, which also change and are a little more stringent. But for years now, for decades, the competitive food, competitive to the USDA regulated food, was unregulated. So you found higher levels of salt, higher levels of fat, lots of candy and chips and other things, which are right next to. So if you remember school, there was the good food and the not so good food, if you want to call it that. So the new regulations force school food service people to change the way they make food. And some districts thought this was a great thing, and they just went for it, and they tried hard to create palatable food for kids, and some didn't, or whatever. So there's a lot of complaints about food waste. So there's anecdotal evidence all over the country of just throwing large amounts of food away because they're forced to adhere to these regulations and kids won't eat it. Mm-hmm. So you can find as many cases that hate it as many cases say, well, this is working fine. Right. So there isn't a coordinated effort to evaluate the effects of it, and it can quickly spiral out of control if it becomes a media thing that lots of people call about, or if there's an organized advocacy group putting pressure on these guys. Then you can only answer so many phone calls, so you have to do something, right?
I never really imagined that there could be parents calling saying, I want my chips back in the line or something. But
there are parents that say, I want my child to make up his own mind. I don't want the government telling me what my child's going to eat.
That's a really good point. That is a great point, and something that I think we will face in the future when we start to look at how we're trying to maybe limit some things that we know scientifically are causing or the rising tide of obesity. And yet we get into issues of personal choice and how do we manage those boundaries. That's going to be a tricky
Well, and I think a lot of times when you look at addressing an issue, one side of it is let's go for incentivizing positive behavior, and the other side is let's limit negative,
Right.
the ability for negative behavior. And the incentivizing is always easier to get through. It's the limitations where you run into a lot of trouble.
Yeah. So, since you're speaking, do you want to talk a little bit about the electronic cigarette ordinance, and then possibly either?
And which is my favorite failure to talk about. I think my real favorite one is the healthy food zone one.
Let's talk about that first.
Yeah, let me talk about that one first, because Rodney's been talking about the soap opera of all of it. I call it the politics of it, but soap opera is perfect. And this example comes from what I mentioned, the Community Health Improvement Plan that the council adopted, and I was very excited about that. I was like, that's really going to help us, give us a path forward. And there was one thing, it was a lot about collaboration. There was one particular item in there that the city could do on its own. And that was, as an entity, not that it wouldn't partner with people. And that was to create healthy food zones around areas where kids gather, schools, parks, libraries, things like that. And there was, as I said, for all of them, there was evidence that that was a positive thing to do. There were resources and national models to use. So I thought, well, great. Well, let's go forward. And it's not like that's something we could just implement. We should talk about it. So I put forward a resolution to gather stakeholders to talk about how we might implement that. We have a very healthy fast food lobby here at the local level, as exists all the way up, through the federal and global level. And doing my due diligence, I called one of my favorite fast food lobbyists and said, "Just want you to know, I'm doing a resolution just to pull people together to talk about this." And I thought, well, the council has endorsed the plan. We have Central Health supporting it. We had some grassroots folks supporting it. And let me just say, I was absolutely astounded at the level of energy that came out against it. And really, I do count it as my favorite failure, because I went down in flames. It was so, you were there. What did it look like?
It was kind of chaotic.
It was crazy.
It was chaotic.
And in the end, I only got 3 votes. And this, mind you, this was just to talk about it.
Right.
Just to talk about it, which, it's not the first time the fast food industry had sway in a way that just blew my mind over the council. And I think that maybe with the new council, it might be time to look at something like that again. I know there's an interest, and sometimes the political landscape changes. Sometimes you just have to do things in phases. Sometimes you just have to get it out there. You fail and you try again.
Right.
Do it.
We all appreciate. I think we should give her a round of applause. It's hard to fail.
It is hard to fail, and it's the only time I lost my cool on the dais.
Oh.
That deserves another round of applause.
Yeah. I was so mad and so blown away, but contemplating it afterwards, it was really a good lesson. I was like, wow, me and Michelle are up against the same thing. Me and Michelle Obama, that's what she's dealing with at the federal level, and this was just a local demonstration of the force at work. So really understanding the political landscape is very critical. And then the second example that you mentioned, the e-cigarettes example, working with Central Health, they came and said, let's expand the no smoking ordinance to include e-cigarettes too. And that was really interesting. I think that was my last year, right? The things were, it was like...
August of 2014.
August of 2014. So as we were working through it and knowing that it was going to be a huge, big deal, it was interesting because right off the bat, one of my colleagues on the Public Health and Human Services Committee said, "I'm not supporting that. I think they're good. I think they help people quit smoking and all that kind of stuff." And you read, when I was reading at that time, I think we didn't even have the which one didn't we have? Either the Heart or
It
Lung.
was Heart Association. They were still
The Heart
studying.
Association,
Yeah.
yes, right. And so, so frankly, what and we have quorum. We can't have walking quorums. I couldn't go around and see, what the rest of my colleagues were doing and going to do on it. And knowing that time was short and that it was, we still didn't even have the Heart Association. I knew we were going to go down with that. But maybe it was too early.
Right.
To actually take that up. Although we did it went through really easily, and that was to ban sale of e-cigarettes and paraphernalia to minors.
Yes.
And
that was very successful.
Yeah.
So, and it passed on consent agenda, which was
exactly
the only e-cigarette ordinance in the state, to our knowledge, that went on consent agenda, that was a big success.
Yeah.
And now
yeah.
state law. That may
Is
have
it?
helped stimulate. Yeah. Well, for
Excellent.
schools. I'm sorry, for school. Well, no, it is a sale. Purchase and sale happened last legislative session. Then schools are obligated to post signs and to restrict use at all school-sponsored events in vehicles and so on. So that could have been a consequence of this early initiative because you were on the front end, the bleeding edge of this issue.
Right. Yeah. We were on the bleeding edge of no texting while driving too. It was back in 2009 or 10, and I think that's another lesson is sometimes you have to take things in phases. Yeah. You can't just do it all at once because when we first did it, first of all, it got all confusing about what are we actually banning because smartphones weren't as common 5 years ago, 6 years ago, and banning just texting wasn't good. We had a really hard time actually writing the language, and the decision was made that we're not going to be able to get it through without huge, enormous controversy if we ban talking on the phone, too. So we banned anything but talking on the phone. And then, of course, that made it completely unenforceable because if the cops saw you holding your phone, you could just say you were talking and all of that. And then last year, we banned it's a hands-free. You are not allowed to use your phone with your hands.
So stages.
So you do sometimes what the community is ready for.
Right. And understanding that. And part of the model that we have here for our Health Equity Policy Council is we have this kind of sections of different representations of folks, one of which is the community and community members, so that we're going to be testing some of our policy ideas to see, is our community ready, for this? Is this something that, our community can support? And that makes me think of a question for you with your experience with the Cancer Society and grassroots. How important is gathering community voices together to influence both elected officials and other policymakers, whether it's the school board or whatever body we're trying to influence, in helping to, once we've got a great policy, how important is that grassroots piece?
It's vital. I think it's one of the most important parts of passing any policy is to ensure that you have community support. And I think oftentimes, in working on SIPO in Austin, our coalition was made up of all health advocates. And of course for us, oh my gosh, this is the best policy in the world. Who would be against it? And I think exactly. And I think that happens with people that are like-minded and you think, oh my gosh, everybody's going to be for this. Who could be against it? And so I think it's really important to cast a really broad net and get people who aren't in your realm who can provide you this perspective of the average person on the street or a mom or whomever. I think it's so important to gather that information. And then of course, I think it's always key with any policy to make sure that we can go to our elected officials and just assure them that this is what the community wants. The community is behind this, they support it, they will support your actions in supporting it, and I think that's so important.
Did y'all do any polling at all to bring results to elected officials?
We did.
Okay.
We did polling initially, just from the very beginning, just kind of a random telephone interview just to determine the community's readiness for a smoke-free campaign. Yeah. And then we did polling again once we knew that it became a full-fledged campaign.
Right.
With a campaign manager, we had a full campaign team. We did a mail-out that we sent out for the election had people going and talking to, Democratic group, Republican groups. I mean, the whole deal. I mean, it ended up being a full-fledged campaign. But we did, we were able to utilize some like tobacco-free kids.
Yes.
The Tobacco Legal Consortium. I mean, we were able to really pull in some organizations that could help us because we were kind of operating on what we called a shoestring budget.
Right.
I mean, I think ultimately that campaign ended up costing about $300,000, if I'm not mistaken.
That's not much.
And that's not much. Once you have 6 mail outs and you're doing print ads and you're doing voter ID and things like that. I mean that really quickly.
Did you have any idea about what the tobacco industry was spending against your dollars? Do you have any sense of that?
I didn't. I knew they were there and I knew they were active. Let me tell you. I mean, you got to the point to where I knew who all the tobacco lobbyists were. I was like, oh, okay, you just finished meeting and talking. Okay. I mean, you just got to the point to where you knew who they were. And of course, we did start to see, and I think this was the scariest thing in the whole campaign, is that when we were getting closer to the election, we started to notice that the opposition was really getting organized.
Oh, yeah.
And we weren't able to determine this, 100%, but we think that was the tobacco industry helping to organize. And they started to make signs, and they were like, "Keep Austin free." And I mean, it's a bar, stupid. Of course they're smoking. I mean, they had a whole campaign. I mean, they had a whole campaign. Yeah. Don't kill live music. Vote against the order. I mean, they had a whole full-fledged campaign. And the good thing for us, and timing-wise, is that they organized a little late. So, if the election was, even further, it would have been, I think, a closer, outcome. But
Yeah, I think we have to keep in mind that there are sometimes well-organized, maybe not so well-organized, but, we are going to have adversaries, and we have to assess, who those groups are, what their capacity is, and how we can, counter that. But at least my experience has been, and I worked in tobacco control policy in Alaska, passing some taxation measures at the state and local levels, and a really well-organized group of the people can overcome, outspending, an industry outspending, I think. Do you agree with that?
Yeah, completely.
Yeah.
In my area, schools, a very well-organized group of moms.
That's what we want, organized moms.
Can urge and change a school district.
Well, don't you think organized moms can change the world? Period? Come on.
My wife would agree for sure. She manages everything I say.
Well, we're going to close this down with one final question, and I really appreciate everybody's feedback, and I hope y'all are enjoying this and learning some inside information about what's happened behind the scenes. But for us, we have this Central Health Equity Policy Council. We're going to be embarking on, one policy that we're going to try to make a change in next year. What advice do you have for us as we are taking this on? What do you want us to keep in mind so that we will be successful? We've talked about a lot of issues. Just choose one that you really think could be impactful. So I'll start down with Dr. Kelder, since...
What should you do?
Yeah, give us some advice.
Well, we've talked about a lot about it, I think. Some of it depends on the type of policy and an analysis of the opposition. Okay. So, the Healthy School Zone may have underestimated that opposition. The food industry has in excess of billions of dollars that they spend on advertising. They can slice a little bit off to fight local. And so, for example, soda tax has been vigorously discussed and shot down all over and here in Texas too at the legislature. So I think understanding the commitment of the opposition is a good idea. I like your phased-in approach. I think that was a good way to start people thinking and getting used to the idea of something that they normally would feel as an infringement in their personal rights to do something in a car. It's my car, it's my phone. I can do what I want. So that kind of an assessment makes sense. So I guess starting in an area that is, reaching that Venn diagram of, some level of political and social acceptability, but also has an opportunity to to be impactful.
Yes.
Because at some point when you water it all the way down,
Exactly.
you're doing nothing whatsoever. So that's the sweet spot that I would encourage this group, which I'm of, to think a little harder
I
and
think
make
you
that choice.
described that beautifully,
Yeah.
really, that sweet spot, where we're pushing things forward. And I think especially as this was a monumental fight that you took on, and I think as we embark, what we're trying to do is educate you about how it can be, but we want to start with something that is in that sweet spot where we can get our feet underneath us, we can build some success and momentum moving forward, and know that then we'll be taking on bigger things as we get that strength built up and experience under our belt. So what's your advice to us?
I guess I want to just play off the issue of not only understanding the opposition, but talking about getting the people out. Two things in terms of effectively moving something forward, in my experience at City Hall. One is that there are wonderful grassroots organizations here that don't say that public health is their focus. But, I'm thinking about neighborhood groups, about Austin Interfaith, the environmental community, Sierra Club, all of those people can be your allies, and yet there are opportunities to connect with them, to go educate their members, and really bring them to the table to be part of your coalition. And then the second thing, in terms of helping to understand the landscape and get a conversation going, and that is to understand that the city has a tremendous board and commission system. I think there's 50 boards and commissions that have citizens on them, and many of them, not one of them is called public health, which, I think it maybe should be. Maybe that could be your advocacy to start a public health commission. But aside from that, there are a lot of them where public health is an essential part of their mission, like the Sustainable Food Policy Board. We have the Women's Commission, the Commission on Seniors, the Hispanic Quality of Life, Asian American Quality of Life, African American Quality of Life, Public Safety. All of those have to think about public health. So I'd really encourage you to interact with them also and figure out where you can insert your conversation at the commission level. Their job is to recommend policy to council. So to have their stamp, or several of them have their stamp on your suggestion could be really powerful.
Oh, that's great advice. Okay, Rodney, take us home.
Take us home. I think more than anything, your policy is your candidate. And I think you have to look at how are you going to get your candidate elected, and in the community and building your campaign around it. I think that's so important. I think you have to be committed for the long haul. Policy doesn't happen overnight. And so, you really have to be committed to that policy to make it happen. And then last, I think research. There you can do so much great research on other communities and talk and even call them, because let me tell you, people are so excited about policies that they work on. Talk to them about what some of their pitfalls were. What were some of their obstacles? How did you guys get through this? And it'll really be helpful, in applying it to your policy initiative in the community. And then last, I just think that there is not one thing that you will work on that will have such a substantial impact to this community and to the world in which we live than policy. So, I think it is an honor to be a part of policy.
Well, thank you. That was beautifully said with a great closing comment. I want to give a big round of applause, please. Going to learn actually from other communities later in the program today, so we'll have that opportunity. And thank you all so much for sharing your expertise with us, and we hope that we can convince you to help us along the way as we're moving some policy forward here locally. And with that, I'm going to turn it back over to Linda Wright.
Sure. Okay.
Yeah,
we have a couple minutes to maybe ask a couple of questions. Does anybody in here have questions of our panelists? And if not, I got fun projects for you. Yes, you have to remember you have to talk in the mic.
Yes, I guess I was listening to Christy Garvey talking about wanting to have a policy that we move forward, something that we can build an infrastructure. And I'm wondering if you would suggest something, a win, maybe a low-hanging fruit that can allow for momentum, or a bold policy, as this really is a multi-stakeholder council and it's trying to do something special. What would be your advice, slow and steady or something bold?
Anybody want to jump at slow and steady or something bold?
I'd go for something bold. Knowing that you might have to, obviously there's lots of compromise that happens and all of that. But really, I think this is a unique gathering of people. And so it really is an opportunity to maybe something bold with steps planned on the way. But I go for bold.
I always like to do both. I like to think about a portfolio of ideas. So if there's a slow and steady one that is slow and steady because it's doing this Venn diagram thing, that there's less opposition, it might not move the needle quite as much, but it might be a precondition to future growth, sort of the way you were thinking about your phone. Although that's kind of bold. Yeah, it was bold too. So it's not as incremental as I mean. But on the other hand, going big is a striking thing, to where you can test the litmus, test the weather, which way the wind is blowing. And so, for example, when I think about in New York City, Mayor Bloomberg trying to take on the soda industry, getting it passed and then getting it repealed. Yeah, that's an interesting set of circumstances. But I think more and more people are getting used to this idea that, as an example, soda is one of the foods that's driving this obesity epidemic. And I will say one of the impediments in the school systems that I'm aware of, because I work with them so closely, is that Texas ranks is the second to last in the nation in per capita public funding of education. So anytime we make a recommendation to a school to do something, even if it doesn't cost very much money, it might cost personnel time, personnel they really don't have. So it narrows the window for being bold in schools because they don't have enough money to absorb new innovations. They give things a try and see if they work or they don't work. So that's a whole other issue, trying to change the funding structure in Texas. But that's a reason why when you work with school, the slow and incremental might be the way to go, because they can't absorb the big and heavy change unless it costs absolutely nothing, like passing any cigarette ban, on campus. They've got people to enforce smoking anyway, so it's really not going to do that much. But so I think big and bold and slow and incremental. I mean, there's room to do both. I would go with the soda tax. I think that's a big and bold thing, and then take the money from that tax and give it to the schools so they have room to innovate.
There you go.
Ronnie, do you have anything else to add?
Well, I think I agree. I mean, I think it has to be bold. I mean, why do it? Seriously. I mean, I think you have to go bold. I mean, there's no question as where you stand on a bold issue.
That's true.
I mean, there's no question. And so, I think you have to go bold.
Well, so you got it. Bold, slow and steady.
You got to put some bacon on the table now and feed people a success, and that means slow, but to a certain extent.
That's true.
But I love bold. Got to go bold. I'm with you guys.
Yeah.
All right, we're going to move to another exercise on this, but let's give Christy and our panel a big round of applause. Okay, in front of you, a little bit of exercise, not a lot. You have a pink card and a green card. Pink and green. One of the things that when I was talking to Christy and with Megan, and Megan, I'm going to need your assistance here in a minute to see if we get these answers right. Thank you guys so much. Greatly appreciate it. Is that you are the Health Equity Policy Council, right? Not the Health Equity Program Council, right? Okay. So we're going to just make sure that our panelists here have told you what policy is. Policies, what's some words that you heard when they were talking about policy? Just shout it out. Upstream. What? Upstream. Upstream, okay. What else did they talk about with policy? Upstream was one. Law. Okay, so there's some sort of governance that is passing this. Anything else?
Rule or decision.
Rule or decision. And good. I heard, what? Ordinance. Anybody hear legacy? I thought that was an interesting word. So it's not something that's short-term, it's something that potentially could be long-term, right? How about entire population? Anybody hear that? That's kind of an interesting one to think about as well. So pink, I wrote it over here, pink is program. Green, which means go, for policy, because you're the health equity, I want to hear it, policy council. And so we're gonna give you our official pink and green ones, but you don't get to vote till after everybody else holds their cards up. I'm gonna read some of these, okay? So you tell me, pink hold up for program or green hold up for policy. All right, here's our first one. Diabetes, self-management, and education classes, a series of 6 90-minute classes designed for people living with type 2 diabetes. Pink program, green policy. Oh, you guys are wonderful. Are they right? Oh, ding, 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 ding. You guys all got it right. Okay, here's another one. School nutrition standards regulate the quality of food that can be sold to students. Pink program, green policy. Did they? Okay, all right. Here's another one. Walk Texas Active Austin is a 10-week series designed to help you begin or maintain a healthy lifestyle. And it's pink. Specialized services for individuals who are HIV positive and have mental illness or problems with substance abuse, including HIV, hepatitis C, and syphilis testing at no cost. A little bit, we were jumping around here a little bit. What is the answer? Pink and why? Can you tell us that?
Sure. These are specialized services. So when you hear the word services, it's a trigger for a program, not a policy.
Okay. But keep being bold out there. Appreciate it. Okay, zoning incentives for real estate developments that incorporate healthy food and creates a single point of access for supermarket operators to interface with city government. Policy or program?
Zoning incentives.
Zoning incentives. Policy or program? Where are we at, Megan? And it's a policy, and why is that?
Zoning, this one's tricky. But zoning incentives, anything with zoning rarely is programmatic. It is almost always policy. So I guess for this particular question, anytime we're talking about zoning, we're thinking of policy.
So again, you're talking about entire populations maybe there a little bit. The Texas Quit Line provides personalized support and tools and strategies to help people become smoke and tobacco free. And that was way easier. That's a pink. Vending machine companies were required to replace unhealthy items with healthier choices such as fresh fruit in city, county buildings. Policy. Okay, mostly there. Is there a couple of people had a pink card?
Sure, when we're looking at this one, we're talking about a requirement for vending machine options, and that's a lasting legacy. So whoever's providing vending services has to abide by that requirement. So it's a policy.
Okay. Community cooking and nutrition education classes for the preparation of meals that are delicious, nutritious, seasonal, and affordable. And that one was another easy one. Pink, you're right. Okay, I got the Z word in here. Zoning restrictions to limit the density of fast food establishments. Everybody's there. Green, great. Whoops. All right, here's our last one. Expanding and subsidizing farmers markets to bring fresh produce into underserved neighborhoods. I got a total mixture here. Oh, and the answer is green. It's a policy. Why is it a policy? We're not talking about everybody.
This is a population-wide approach, but we're talking about expanding and subsidizing farmers markets. So that's a policy level. I know, and that's the easiest answer, is that it's for farmers markets, and it's when you're talking about expansion and subsidization, that's policy.
All right, before we move on to the next section, what do you, any thoughts on policy versus programs that you might have picked up today or that you'd like to share, or you have questions because you disagree with the pink and green exercise? No? We are ready for the next thing? Do you need to stand up for a second? Yep, we got one, I'm sorry. Hold on, I'm coming.
I think my question is about that last one. I think that one's a little bit more confusing because it's a subsidy for a small section of, I guess, businesses or population. What is a good litmus test for a subsidy, a limited subsidy like that?
All right, is that something that you can answer, Megan, or is that something I need to ask? Oh, he's talking, the professor down there. Hold on.
That's a really excellent question, and I actually pulled this from that community health improvement program that Laura Morrison was talking about. So why don't, after today, I'll pull the section that this comes from, and maybe I can send out a further explanation on that. But thank you for that, trying to clarify that. Oh, looks like Joy might have something.
Oh, Joy has something to add? No, sorry, I was looking for Joy.
I can speak to that. I work for Sustainable Food Center and our farmers markets that we run 4 farmers markets, and they do over $1 million in sales. So if you're looking not over, say, Austin or even just Travis County, the amount of farmers markets there are and the amount of people that are using them, it would be the same thing if it were written, I think, for a grocery store or something, but it's not written to say this one taco stand named Tacos R Us gets a subsidy or something like that. I think it's for a broad category, especially when you look at the public health implications of kind of the idea of it's bringing access to fresh food. I don't know if that kind of
Does that help a little bit?
answers a little bit, but I think just it's not, I think at this point in time, it's not something that's just serving, 5 people. It's really kind of this broad-based approach.
All right, everybody stand up for 2 seconds. Because we are talking about physical, right? And if you're going to have some blood going on here. And as we're doing that, the panelists for the next group could come on up. We're going to talk about specific policies around those health indicators systems. But don't go too far. You got about a minute.